everybody. We've been exploring what to expect when you're expecting during COVID-19 with our resident expert, board certified OBGYN and author, Dr. Eboni January, who has St. Louis roots and has actually been working on the front lines in New York. Dr. January, what have you been up to? Get us caught up in terms of what you've been up to and what you've been seeing since the last time we talked.
Wow. So kind of, for the most part, really the same thing, still working. Things have, to a certain degree, calmed down, but now it's just living in this new normal, and still trying to implement certain rules and regulations and learning how to care for patients. That's been the biggest change for me since we last spoke, is learning how to care for patients with COVID-19.
I think that the big thing when we talked last, there was a lot of uncertainty, right? We were just kind of like flying by the seat of our pants and trying to make things. You're talking now, there's a little bit more written policy procedures. How are we, expediting patient care? Is that what you're talking about?
Absolutely. And even like the unwritten policies, it's kind of like, you're making it up as you go, a lot of places, and, not just the hospital, but you got the airlines and things like that are just kind of, making things up, like what makes sense to them. So that's where we are now.
I'm getting the sense that there's been a lot of women delivering babies and who are still expecting, and even though the numbers are up and down all over the place, talk to me a lot about the delivery process and what that's like for an expectant mother at this point during the COVID-19 pandemic.
Right. So right now, typically, when I was delivering in St. Louis quite a bit, you have 4 or 5 people in the delivery room. Now, obviously that's not the case. Usually it's just one other person is in the labor room with you. C-section suite has always been that way, but in the actual labor room, if you're having a vaginal delivery, it's just one person. So not a ton of people can, accompany you during the delivery process. So that is one of the huge, some of the things that have changed so much. Sometimes other people would like their kids there. Now there are no kids. It's just, significant other or one other person who you'd like to be in the delivery room. So that has changed things quite a bit. That's one of the major things from a patient standpoint. Sometimes they want to share this moment with multiple people, and right now it's just one person. From a physician standpoint, like, wow, it's changed quite a bit. One, we have to put on PPE prior to going into the room. But then when you get in the room, then you have to gown again. So you actually have to have the gown that you're going to deliver in, your gloves in. So, you got gloves on top of gloves, a gown on top of a gown. Depending on what hospital you're in, they have designated rooms where COVID-19 positive patients will be. So if you're positive for COVID-19 during your pregnancy, then they'll put you in a room to where you kind of like, isolated on your own. Many times these rooms don't necessarily have, the equipment in there. They've stripped these rooms of everything that we typically would need as an OBGYN. So things have changed quite a bit with regards to the delivery process.
Yeah, I think if I were an expectant mother, that would be like where my thought process is. I'm positive for COVID. I go into the hospital to deliver. What happens?
Yeah, absolutely. So one, you have to call ahead. So that's the one thing. Most people are just trying to get to the hospital if they're in labor. But now you got to think, oh, I'm in labor. I was just recently diagnosed with COVID-19. I need to let them know that I'm coming so that they can prepare for me. If there are only so many rooms that are designated to COVID-19 positive patients and they're full, now what? I have to, make sure the staff know so that they may protect themselves, because when you walk through a waiting room or, the front desk of a labor and delivery, people aren't wearing N95s, right? So you got to let them know, hey, you're coming into contact with me. I'm positive for COVID-19. And as a mom who's delivering in pain, you're not really thinking of those things. So, but that, is something that I would suggest, if you're delivering and you've recently diagnosed, definitely call to let them know that you're coming so that the staff can prepare for you.
The other concern I have is if I deliver and then my symptoms, I deteriorate, my health deteriorates, what happens after I deliver, what's my care like as a parent, but then also for my newborn.
Right. So one, pregnant women are at higher risk for being put on ventilation. They're not at higher risk for COVID-19. Pregnant women do very well with regards to, protecting themselves. But if they were to develop it, and have various comorbidities, then they are more likely to go to the ICU and be placed on the vent. The great thing about, as far as it affecting the baby, is that we have not seen a ton of cases with it being passed to the baby, vertical transmission at all. Not a ton at all.
Okay, that's interesting.
Yeah.
So if a mother chooses to breastfeed, is that an option if she's positive for COVID-19?
So there are very few contraindications to breastfeeding. COVID-19 is not one of those. Right now, obviously, we don't know enough, but as of right now, we have had moms to breastfeed if they were COVID-19 positive.
All right, let's back up a minute here. I'm still pregnant, and I contract COVID-19. Already, I know if I get a cold or something else, I'm really limited on what I can take to help treat the symptoms. Are there things that are safe for pregnant mothers to take to treat their COVID symptoms? What are your recommendations?
Okay, so actually, that is a huge misconception, is that there are a lot of medicines that you cannot take with regards to being, sick, common cold, things like that. Most medicines, most over-the-counter medicines you actually can take in pregnancy. So Benadryl, Sudafed, Robitussin, all of those things are safe to take in pregnancy. They're absolutely safe. Now, obviously, you can't take Motrin, Advil, Aleve, but if you're talking about cough syrups and, upper respiratory infection symptoms, there are a ton of medications that you can actually take. So Tylenol is completely safe. Sudafed, Robitussin, those kind of things. Those are all completely safe to take in pregnancy.
Perfect. In our other segments, we talked about being proactive and exercise, and any of those topics that you want to revisit where you feel like it's important to touch on again, or maybe something's changed since the last time we talked.
No, absolutely not. You always want to prevent. One of the things when we have, typically if a patient comes to visit me and they say, I like to get pregnant, one of the things that I'm going to tell them is make sure that you're at your optimal health, right? So make sure that you're at a nice, healthy weight. If you have any comorbidities, whether it's diabetes, hypertension, that you have those under control. Let's say you're on psychiatric medicine. One of the things when people have psychiatric diseases, they can be on multiple medications. What we try and do is work with psych doctors to really consolidate the medication so that a woman is just on one medication if she has psychiatric illness. So what you want to do prevention-wise before you get pregnant, which is maximize, be at the most optimal health that you can possibly be. And you would do the same thing to prevent COVID-19. If you are pregnant with issues with regards to hypertension, diabetes, overweight, anything like that, you want to work on those things because you want to be able to fight off that infection. And you're able to fight off that infection when you're at your most optimal health. And that is diabetes under control if you're a diabetic. It doesn't mean that you're going to do very poorly if you're diabetic, but if you are controlling your diabetes, staying on top of your blood sugars, eating well, and building your immune system, you'll be just fine. Obviously sometimes that's not always the case, but the main thing is prevention. By maximizing your health, making sure that you're the most healthy that you can be, and then 2, building your immune system.
Well, Dr. January, I always love talking to you because you always give us the lowdown on what we need to know and also a really nice, healthy, no pun intended or pun intended, perspective on how to keep ourselves well. Thank you so much for your insights.
You're welcome.
And we want to be able to make sure we connect you, our viewers, with more about Dr. January. Check her out on all her social media channels. And don't forget to check out our other segments with Dr. Eboni January right here on STL TV through our YouTube channel and what to expect when you're expecting during COVID-19.